Thank you guys for joining us for this Ask Me Anything on a Tuesday, the LSU edition. I am lucky enough to have two doctors who have come from the LSU school who are working in Louisiana. So they should give you a lot of insight into, their journey and how they came about working with Aspen and how it's going. Um, Before we get started, my name is Will. I'm the Academic and Industry Relations Manager for District 5. I work for Aspen Dental Management. That's the support company that supports the over 800 dentist-owned practices in 43 states. Support areas such as inventory, supplies, HR, pretty much anything you can think of to help the doctor stay focused on patient care. Our goal is to help the doctors succeed with whatever goals they have. And since it is a partnership, when they succeed, we as a company succeed. So before we get started with those questions, I'm going to hand it off to Dr. Brady first. If you want to do a quick introduction, and then we'll go with Dr. Hooper, and then we'll get into the questions.
Sure. My name is Matthew Brady. I graduated from LSU in 2012. After graduation, I did a 1-year general practice residency in New Orleans at University Hospital. So I didn't really get out and practicing until the end of 2013. I'm originally from New Iberia, Louisiana, and my wife and I's family are still located there. So we knew that we always wanted to end up back in that area. So we relocated to that area after graduation. And I hooked up with a dentist that was looking for an associate and stayed there for about like 4 to 5 years working in private practice. So I have a lot of experience in that arena as well. The goal was always to have me buy out his practice and to transition into the owner, but we could never really come to an agreement on how to make that transition happen. And so I did end up leaving in February of 2018 and started working at Aspen then. And since then, it's been great. I bought the New Iberia practice in February of 2019. So about a year after I started, became a practice owner, and then bought the Lafayette, Louisiana office in October of 2019. So I own 2 practices currently, mainly working in the New Iberia one, but also occasionally in the Lafayette office as well. And my experience with Aspen has been really great so far. So I'm happy that I made that change, and it's really something that I do not regret in my dental career.
Thank you, Dr. Brady. Dr. Hooper?
Hi, I'm Tabby Hooper. My story is quite a little bit shorter, mainly because I graduated just this past year. So I graduated in May of 2020 and just started with Aspen in August, so a couple months back.
Okay. So we're going to get a lot of good perspective from not only Dr. Brady with his private practice and now Aspen ownership, but with Dr. Hooper just graduating and just starting with us. So she's more familiar with what you guys are going through more recently. So on the bottom of the screen, there is a Q&A function. So if at any time we're talking and you have a specific question, feel free to type that in and we'll work those in as we get going. So let's start off with Dr. Hooper. You said you graduated in May. What options did you have entering the workforce, and why ultimately did you choose Aspen Dental?
I also had a couple offices that I was kind of interested in, maybe even buying, purchasing. I worked for a dentist in the past, and she was interested in me buying her office. I just didn't really feel prepared to do that, especially in such an uncertain environment with COVID and, everything hasn't really shifted. But I just didn't feel that I was particularly ready, where my craft needed to be, where my speed needed to be. And I just didn't really want that kind of responsibility. My student loans felt like a big enough burden to add on top of that, purchasing a practice and worrying about, my staff and everybody else. It just felt like a lot coming out of school. So I kind of looked into that, and then I looked at a couple other, associate positions, and it just felt like a better fit for me, and an environment where I could grow and really achieve my dreams and goals much quicker than really anywhere else without having to worry so much about the day-to-day part of it, like the business part of it, to where I can really focus on, on my speed and my patient care, and just kind of really get more efficient and better at what I'm doing.
I think that's a good point. Dr. Brady, you said you did a residency program. A lot of the questions we have is, why should they choose to, I guess, come work for Aspen Dental or residency? Now, looking back, you chose the residency. Is that the same decision you think you'd make if you were making the decision now?
I think that yeah, I probably would have still made that decision. For me, it was a good decision. It definitely helped with my skills as far as and it depends on what type of residency you're thinking about doing. In my case, it was a general practice residency at University Hospital, so it's very extraction heavy focus with sedation dentistry as well, and that's something that I still use in the practice. We are not doing IV sedation, but we are doing like oral sedation and stuff, so that's definitely helped out. Um, Now, that being said, I will say that I feel like even being out in private practice for about like 4 to 5 years, just being in an Aspen practice in the first like 6 months or something, I could see my speed increasing. I can only imagine what it would be like if you were a new grad um, as well. So it's kind of like a pressure cooker. It will definitely make you evolve your skills and sharpen your skills. And it's something like a well-oiled machine after a certain period of time. If you're coming in and you're putting in the hours every day, you're going to get better. And the more hours that you're putting in, the faster that progression is going to happen. So um, either way, you're going to end up as a better dentist. For me personally, I think I still probably would have done, I wouldn't change anything. I still ended up in Aspen anyway. Um, it's just something of however they're feeling they need to pursue their career. I would say, do that.
That's a good point. And then you said you spent 4 or 5 years in private practice. A question that just came in: what are some of the main differences between private practice and Aspen with your experience?
The patient volume would definitely be one. Now it depends on what type of private practice you're going to work for. The one that I worked in was kind of, I guess, in like the twilight years. It was a dentist that was getting older, that was kind of on his way out. Wasn't really interested in building the practice anymore. Honestly, it probably could have been seeing what I do today. Like I could have run that practice, by myself, and he probably could have too. But we were just kind of splitting the work of a single dentist in two. And so I spent a lot of time in the office, just kind of like playing on the phone or reading books or doing whatever. And that kind of gets boring after a while. You go to school for 4 years, and 4 years before that, and you want to feel like your skills are getting used. I felt like like a tool that was up on a shelf that was getting rusty, and so I wanted to expand my skills and kind of go out on my own. And that's one of the reasons why I ended up leaving the office to kind of pursue a more, I guess, a busier type atmosphere.
Yeah, that's a good point. That's something for me to learn too, because I don't talk to a lot of doctors who have been in the private practice. So I appreciate that answer. Dr. Hooper, going back to your 4th year of dental school, what are some of the things that you wish you would have known now that you're actually working in a dental office?
Um, Probably just focus on speed, and I was already kind of doing that a little bit, mainly because I did have my son during my 4th year. So I was trying to, get myself set up to where, I could be out for 2 months during that time, which I did. But, looking back, I probably could have done quite a bit more, just because, in school, you're used to that one patient in the morning, one patient in the afternoon. And, if you get 3 in a day, then you feel really accomplished. But, it's just focusing on my speed and just doing everything. And I'm a little shy when it comes to trying new things and things like that, but really just get any kind of opportunity and shadow somebody. Just get your hands in just about anything. You have the big opportunity having all those specialties around you, and just kind of try to learn from everybody. Like if you're not doing anything that day, just go to, I don't know, endo, go to perio, go to whatever, residency program that we have that, they're doing something, just kind of watch, like I learn a lot just by seeing it. So at school, we do have that opportunity, and, you can just try to take advantage of that.
Good. A follow-up question that just came in is, what kind of questions should dental students be asking when they're looking for positions? Or what kind of questions did you ask?
Dr. Brady? Or
You're going to want to ask how you're compensated, and make sure that that's clear and in writing, about, because basically most models will work off of a percentage of production, or a daily guarantee, but usually the guarantee is going to be much less than what you're going to do if you work off of a percentage. It's usually about like a third, so like 33% of what you produce. You need to know whether or not the lab fees or any kind of other kind of fees come out of your end or the owner's end, so that you'll know, like, if you're doing more lab-based stuff, you may make a little bit more, but some of that money is going to have to come out of the profits that you make. That's like the biggest thing. Another thing would maybe be to ask questions about like practice philosophy. If you can get into the practice and maybe watch how the doctor treatment plans things and see if their treatment planning style aligns with yours, that would be definitely something that I would recommend as well. And then maybe ask questions about like, autonomy, as far as like what you would be asked to do if you're going to be doing only emergency exams and treatment planning stuff for the doctor versus you're going to have your own patients that are going to be your patients, and like who gets to see the new patients, that sort of thing would be what I would ask.
Anything to add, Dr. Hooper?
It's kind of the same thing that, when I was interviewing, I was looking at, just treatment planning, how much autonomy do you really have with that, and yes, if it was a practice that you're working on as an associate, is who gets the new patients, and are you going to be busy doing fillings all day and you get a part of that production, and then the other dentist is getting the bigger cases like crowns and implants and whatever else, and things like that. Do you have your own patients, and whatever you end up treatment planning on them, it's yours to do, or just kind of understanding how that works for that particular practice, I think would be important.
Both of those are good questions and are good questions to ask. This one just came in. When should a fourth year dental student start looking for positions? Either one of you guys might have different answers.
Now would be a good time if you haven't already, probably.
Yeah.
You want to have, you want to have options.
I kind of got stuck, and a part of the reason why I ended up doing a residency was because I couldn't really find a job at first, and so like, yeah, definitely don't try to have like one basket that you put all your eggs in. If you can have multiple different options, like Dr. Hooper was saying, that'll definitely help you out. So just go out, look for who's hiring, go visit some places, and just try to have as many doors open as possible.
Good answers. This one just came in. You both kind of mentioned autonomy. This one says, do you guys get to do your own treatment plans? Is there any quotas that you have to meet when you're treatment planning? Dr. Hooper, if you want to start.
Yeah, I absolutely do have, autonomy in everything that I'm treatment planning. Like, you get to see a new patient from beginning really to end. You get to see the x-rays, you do the exam, you have your hygienist check, or however way you decide, and go into the office. But whatever you treatment plan, we just, really try to focus on being very, just thorough, and make sure that, you're not just treatment planning the one problem they came in with, but you're looking at everything else. So, if they need a partial, if they need implants, bridges, or whatever else, then you kind of, just put it all in a treatment plan. And then you get your office manager, coordinator to kind of talk to the patient afterwards. But it's really depending to the patient what they, I always just kind of, I'm starting to say kind of the same thing over and over, to the patients, to where you walk them through, okay, you can do a partial, you can do a bridge, you can do implants, and I just try to really not focus on, okay, oh, I don't think this patient can afford it, or they're not going to like this, or they're not going to like that, just kind of just be thorough and give them all their options and kind of explain all of their options to them.
Yeah, there's from the day that I started, there's been no issues with any kind of oversight over clinical autonomy. You can do basically whatever you want to do. The biggest thing is that they want you to care for the patient, and things that you learn, or that they definitely do want to focus on comprehensive treatment, which is something that if you're in private practice like I was for like 4 or 5 years, it's really a hard sell to try to get people to even listen to you about comprehensive treatment. They come in with usually a one-tooth problem, and they want to try to keep it a one-tooth problem and not really get into anything else. And we really focus on trying to treat the entire mouth and make sure that, because a lot of these patients haven't been to the dentist, if ever, in a long time. And so they usually have a lot of stuff that needs to get done. So we start by doing a comprehensive exam to make sure that we're not missing anything by just focusing narrowly into those smaller problems. We don't have any kind of quotas or anything like that that we have to meet. We do have goals, like, and this is exactly the same as it was when I was in private practice. We had goals in the office too. That's not going to change anywhere that you go. You're going to have like goals and stuff that the office is going to want to try to meet: production goals, new patient goals, patient satisfaction goals. It's not all about money. It's goals like all over the place, but it's not like hard fixed, like you're going to get fired if you don't do this much this month or whatever. It's just to try to push people and to try to grow and do better for the practice.
Good point, Doctor. This question just came in. Dr. Hooper, have you taken any CE courses since you've graduated? And are there any that y'all recommend that have really helped you escalate your skills?
I did take some, probably not as much as I thought I would by this point. I took some of the Invisalign courses so far, and things like that. But right now, I'm very lucky that I have my mentor in the office. And Dr. Zeta has been really, really helpful, in helping me just grow tremendously. So I've been kind of focusing a little bit on that and just relying a little bit on his expertise and, just experience. So I'm trying to learn as much as I can from him while he's in the office before he moves along. But just while I'm there, but I definitely about to apply for some more CE courses and learn more from that perspective as well.
Dr. Brady, since you've started, any CE courses that Aspen has provided to you that you would recommend?
Yeah, so in Aspen and Invisalign kind of launched a partnership in February, or around the time that I bought the practice in 2019, like the earlier part of 2019. And when that happened, basically all the owner offices got iTero scanner machines. So we did have an event where we went and learned how to use the iTeros, did Invisalign training with Dr. Galler, who's really great, who recently left the company, but is a really big Invisalign guy. Recently, they rolled out some implant continuing education stuff that right now is mainly online due to COVID-19. So I'm working my way through that as well, with the ultimate goal of being able to go and do live implant training and eventually start placing implants in the practice. So they do have, and it's in their best interest to make sure that we're trained, and that because it's more services that we can offer, more things that we can keep inside the practice and not have to refer out as much. So they are big on CE. It's just a little difficult right now, as I'm sure it is for everybody, to be able to get out and get places to actually do it.
Yeah, I know pre-pandemic, I know the doctor development program that most doctors would start on is about 100 credits of CEs through the first 2 years. That's Invisalign, implant, restoring, implant placement. Pandemic kind of put a lot of that on hold, but there is a plan for most doctors who come in to continue the education, especially around Invisalign and implants. And right now, until the end of the year, we've opened up our CE library. So if you guys want to check it out, there's no cost or anything. You can go online and choose any course you want, but it's aspendentalce.com. And like I said, you can get access to our entire library, and that's through the end of the year. So good questions, guys. Thank you for those. Let's go to, we went a little bit over compensation. And Dr. Brady, you talked about guys were doing the work of one doctor, but you were both there. A lot of the questions come in. How does Aspen pay? Is it based on production? Are you fighting for procedures with the other doctors in the office? And we'll start with Dr. Brady.
So it depends on what type of position that you have in Aspen. And as an associate, you'll be paid like a certain daily rate that's guaranteed. That way you're not really having to whether you do like $1,800 in production or you do like $3,500 or more, you're going to get paid the same amount. Dr. Hooper, it's been a while since and I've never really had an associate that was in the office. Do y'all have any profit sharing incentives?
So we do. I think so far though, since I got hired, it was 2 associates in the office plus the other doctor. So I don't think there's really much left over, and it's been a little bit low, but we do. So as an associate, you can get a certain percentage of that profit past your daily guarantee as well.
Right. And the same.
Just we have a fairly small office, so.
Yeah, and the same works for Aspen has a position, the managing clinical director, and that's basically like the if you don't have a practice owner, that's kind of like the head of the clinic. They would get a bigger percentage of the profits than the associate would, and then like the practice owner would get the most percentage of the profits after that. But everybody gets paid their daily rate. That doesn't get like taken back from you or anything like that. It doesn't matter. Like, and I mean, like if you're not the practice owner, if the practice isn't really making money, the practice owner is going to pay you regardless of that. So I mean, so you don't really have to worry about. I mean, you do want to be making more, like you want to get an incentive and stuff, but you're going to get your daily rate regardless of if the practice is profitable or not.
Yeah, I think you both answered that perfectly. An associate will get their guaranteed daily draw paid out bi-weekly. And then there's an 8 to 10% profit share that they're eligible for. And that's based on if the practice is successful. So the lead dentist, all other associate dentists, hygiene, there's any specialty, everybody's production goes into the one pot. And then what the profits are left after your direct costs is where that profit share comes from. So, and the lead, go ahead, Dr. Brady.
And the profit sharing is based on like patient satisfaction metrics too. So it's kind of incentivizing you to not only do a lot of production, but to do a good job as well, so that people are happy. And then whenever they're happy, then you also can get a percentage of the profits.
Good point, Doc. Let's go a little bit into ownership. So you decided to join Aspen in February 2018. You worked for a year. What made you decide that you wanted to invest in the practices and buy the practices first? And then what made you decide that?
So I'm going to be honest, when I got to the office, so my story was, I didn't elaborate as much, but when I decided to leave the practice that I was in, I really was not interested in going to Aspen or to any kind of a dental support organization. I had some other offices to go out on my own and maybe start my own practice. And that's kind of what I wanted to do, but the timing just wasn't happening. So my wife was like, they're building an Aspen in Iberia. Why don't you just ask them, what it's about. You may like it. And I was like, I'm not going to do that. There's no way I'm going to do some corporate dentistry thing, because you hear all that stuff, horror stories and everything. So I had this big list of questions that I was going to ask him. I was sure I was going to find something that was going to stump them. And so I got with the recruiter and I asked him about, well, I'm sure you're going to make me sign like a non-compete contract. I'm from this town. I want to be able to practice in this town if I leave. And they were like, no, you can leave. You can practice wherever. It's not a big deal. I was like, well, there's got to be like you're going to make me work there for 2 years and I'll have to pay a penalty. And like, no, if you don't like it, you can leave like in 3 weeks, 6 weeks. It doesn't matter. I was like, okay. And I was like, well, you're probably not going to pay me that much then. And then they started breaking down the numbers and I was like, well, that's like more than I'm getting paid now. And it was like, so it started to get a little bit sweeter and sweeter. Now, when I got there, I will be honest, the office had just opened up. It'd only been open for like maybe 4 or 5 months. It was rough. It wasn't used to the practice that I left was slower, but it was a well-oiled machine. Everything kind of worked. So it took me a little while. We had some office turnover. We had to get things in the right place before it started to work. But once it did work, it did start to get really, really good. And as the production and stuff increased and everything, they kind of approached me and they were asking about, um, they knew that my goal ultimately was to be an owner. They're like, well, why don't you be an owner with Aspen? And they kind of started talking to me about some stuff, and we looked at the numbers. And then whenever it made sense and the practice was profitable, they approached me about getting into that process. And we did that dance for like maybe like I'd made the decision to buy like probably like 6 months in, but it just took another like 3 or 4 months for us to get everything right and to make sure that I was comfortable before we actually like pulled the trigger. Um, but yeah, but it was a good decision. I'm glad that I did it, and it was significantly less of an investment than it had I tried to open up my own practice, and so I don't regret it.
That's good to hear. Dr. Hooper, this question just came in. What does the day in the life of an associate at Aspen look like?
Right now, I'm really kind of training and becoming an MCD as well too. So it's a little bit different than if I were to just stay as an associate probably. So I'm trying to do maybe a little bit more just to, just to pick up my speed. So normally if I was just an associate, you would have like a production column. Then you have to where, your patients like your crowns, bridges, fillings, anything like that goes into that column. And then you have your overflow column to where, any kind of like low denture steps or things like that that you don't necessarily get paid that day go into that. And then you also have your new patient column. Our new patients exams are free. So, you don't really get paid on new patients, but if you get any kind of same day starts or anything like that, then they go back into your production column for those patients as well. So you just get to see a lot of, new patients and, try to do your production columns. So right now, because it's me and my mentor in the office, we have two of those production columns. So I'm trying to really see as much as I can of those two columns. But if I get backed up, then my mentor helps me with that. So
And the follow-up question, and this will be for both of you, and we'll start with you, Dr. Hooper. You're getting ready to be the lead dentist. What are the differences in responsibility between a MCD or lead dentist and an associate dentist?
I think as an associate, you can focus a lot more on just what are you doing that day, with your patients and things like that. As a lead dentist, you really have more of the flow of the office, just making sure that the schedule is, filled for the day, for the week and things like that. So you get more of that overseer of the whole office than if you're just an associate. And as an associate, really, you can go in and out in other offices as well. So like, if a dentist is not there that week or for a day or things like that, you get to travel a little bit more than the lead doctor would for that office.
Dr. Brady, anything
Dr.
to add?
Brady can add to that.
As far as the difference between the associate and the MCD,
Yeah.
yeah, kind of what Dr. Hooper was saying, I would agree. The associate's kind of more, you're going to be responsible for basically like your column of production, maybe a few new patient exams, maybe a few overflow steps and stuff, but you're kind of staying more and just kind of doing work, and you come in at whatever and you leave whenever. The managing clinical director is more responsible for, like she said, basically everything else in the office, making sure that the flow is okay, that people are having a good experience. Usually you'll see any problems that arise with treatment or whatever, denture remakes. You gotta be the guy that's got to see, maybe make decisions about if refunds need to be had, or if we need to fix this to make a patient happy. You got to be that guy that's got to be the Navy SEAL or Special Forces guy to go in and fix the problems. You're ultimately responsible for everything that goes on in the practice at that point.
That's a good point. This question just came in. If you do want to be an owner, do you get to take part in the design process, or do you buy into one? Or I guess what all control do you have over once you buy the practice, Dr. Brady?
So you don't really have control over the like architecture or design of the office as much. And that could be, depending on what your perspective is, that could be a plus or a minus. For me, I'm not so much wanting to get into all the details and stuff. That's kind of what I wanted Aspen for. So they handle all that stuff, all the builders, all the everything. Now, in my case, the office was already built, but like if you're interested in a location that's not already built, there are some things that you can kind of that I'm told that you can have input on, but a lot of this stuff they have contractors and they're doing things already in a pretty cost effective way. So there's not really much that you're going to add to that equation that's really going to be beneficial, I think. And same with equipment. They're going to outfit the offices with reliable equipment. I can vouch for it. It doesn't break or anything like that. But you're not going to be able to pick out if you want like a designer chair or something like that. There are realistic limitations to how much autonomy and control you have over that part of the office. Um, so yeah, I'm trying to think. That's pretty much it. I mean, and it depends on, again, like I didn't want to. Will, I don't know if you want to. I can go into a little bit about like how the ownership part works, about like what you actually own, because I know that was a big part that I wanted to know. So as an owner, you don't really own like the building or the equipment or anything like that. You own a percentage of the profit share, basically. So for some people, that may be a downside. Like they want to own all their equipment, they want to own the building and the real estate and everything like that. I didn't really want that much hassle. I wanted to, like, whenever I was ready to get done and sell the practice or whatever, I could just walk away from it. I didn't have to worry about, because the guy that I worked for, like, he had like panos in his house from the 90s that he couldn't get rid of. All these guys from Shine and stuff will tell you like, all this equipment's like an investment and all this kind of stuff. It's not. It's, you're not gonna. It's gonna be hard to sell it to somebody else. Everybody wants new equipment anyway, so I really didn't want that responsibility to have all this equipment and stuff like that and have to maintain it. They take care of that. If I have problems with stuff, we call Shine, they come out and fix it. I don't have to worry about taking care of the bill or whatever. So it just kind of depends on what you do. For me, it works this way. For other people, they may want more control over stuff, but I'm okay with letting Aspen handle that portion of it.
Yeah, that's a good point, Dr. Brady. You mentioned Henry Shine and some of the equipment. Dr. Hooper, what happens if you need a certain tool or instrument? Do you have full control over what materials you use, and how does that work?
I mean, when I came in the office, there were certain things that they were already in place, and certain things that they were using, and for the most part, that's the stuff that I would have used anyhow. And then if there's something specific that I would like or that I want, then we kind of just work it in the budget. So every month you have a certain budget for for your supplies and things like that, and you just kind of order. And really, it's usually like your head assistant that would order and kind of take care of that part for you. But you just put all those things on a list, and like, now I want a laser, so we're trying to work that into the budget maybe soon. But things like that some things, I guess, you need an approval, like they're bigger items. But for the most day in day out things, then you just kind of order and work them into the budget. Sometimes you might not be able to order it that month, but the following month or things like that.
Dr. Brady, anything to add on that?
No, that's pretty much it. Like any of your normal everyday supplies, different types of endo supplies, composite materials, extraction forceps, and things like that. That you have complete control over. You can order it. I mean, unless you're wanting like some boutique forceps that cost like $2,000 a pair or something like that. That you might have to get approval for. But like if you just want a certain type of instrument or whatever, absolutely, that's no problem. The bigger things like the laser and stuff like that, we have to get approval for. But I mean, I have one in my office. There's no issue with getting that usually. Um, I mean, we even like we did the thing with the iTero scanner that we got. We are getting a CBCT scanner in New Iberia and Lafayette. So I mean, like, stuff happens, and they'll get you supplies, especially if it's going to be a return on investment.
Yeah, so thank you both for that answer. I'll just add that Henry Schein, we're the second largest, buyer from Henry Schein, second to the U.S. government. So we have really good prices on equipment. Like you said, doctors getting CBCTs. All of our new offices are being equipped with CBCTs now going forward. So we hope to have all the technology you need to further your clinical skills. So great answer, guys. This one came in, and this one we'll start with Dr. Brady. How has COVID impacted your business?
Initially, very much. So like in March, we were on track to do to have our best month ever that month, and then COVID came in and pretty much like wiped that all out. And we were very slow for about like 2 to 3 months until June or July. And then finally, like August and September, we started to kind of pick up. So it's been about like 6 months or so for that we've been really kind of slow. Um, Now, I never stopped seeing patients. We were only doing emergencies only, but with having Aspen with the call center and stuff like that, television commercials still on and everything, and our name out there, and a lot of other dentists not open. Like I was seeing, at least like 4 to 5 emergency patients every day doing extractions and stuff. Seeing people from, and I'm in New Iberia. I was seeing people from Shreveport, like Charles, Baton Rouge, like people driving in just to get out of pain. And I mean, it did make me feel good at the time that we were doing a service for these patients, keeping them out of the emergency room, especially at a time whenever resources were so constrained, and making sure that they're not taking up time in an emergency room when we can see them and actually give them definitive treatment. Now since then, we're back, stronger than ever. That pent up demand has like really turned into like a lot of demand. We're doing promotional events where basically we did it today. On Tuesdays, we will we call it a new patient blitz, where we'll see basically afternoon, we just do nothing but new patients. Today we saw 15 new patients in one day. When I was in my other private practice job, we might see 15 new patients a month. So it's like we're doing like a lot of new patient exams. We're seeing a lot of demand, so that turns into revenue and treatment. So.
And Dr. Hooper, have you started in May? How has it?
Started in August.
August, okay. So how do you feel safe working with COVID going on? I guess would be a question I have for you.
Okay. Yeah, I think our office kind of went through the same thing from what I heard about it, and mainly because we are that kind of like emergency type setup to where patients can kind of walk in if they need a new patient. Then we were able to open up a lot quicker because you can see those emergency type situations. But yeah, I mean, we have all the PPE that we need, and just wearing masks in the office really most of the time, and just trying to stay safe for our family and friends, too. So.
Good. This question just came in, Dr. Hooper. What type of support has Aspen Dental provided for you as a new grad just starting?
I think the biggest thing for me that was really important was mentorship. And that's kind of what I wanted, because I wanted to grow and I wanted to grow quickly. And, really, you don't really learn doing everything all at once. But when you have, a person that has that experience, I feel like you can learn a lot quicker, and just not having to go through all those things that would fail you before you learn the one thing that works. You can kind of just see from their experience what is that one thing that works for them, and maybe go from there. Try that first. If it works for you, great. Then maybe find other solutions for things. But mentorship was definitely the biggest thing for me that I was looking for. Getting out of school, because I knew that we had limited experience. I mean, LSU is great and it gives you all the tools that you need to be successful, but you have a very limited experience. I probably did more extractions in a day than I did in, all 4 years at LSU with, with Aspen. So things like that that was my biggest thing. I just wanted somebody that can mentor me and I can grow and learn. And I mean, I'm still doing that. Early into the process, but
Dr. Brady, same question. You've been with Aspen a little bit longer. What's maybe the biggest support that you've seen from Aspen since you've been with us?
Well, probably the biggest support was during the pandemic. I mean, you know, that was a really, really stressful time, especially, I'm owning two practices. All of a sudden, I'm having to close or reduce hours a lot. I still had practice notes that were due. Luckily, with Aspen, because they work hand in hand with a lot of the banks that we have our loans through, they were able to negotiate, stop payments on all those things for a few months to kind of give us some breathing room. They helped. We were able to get assistance with the payroll protection program to keep our employees paid, and also to kind of protect the bottom line profits and everything. And they were, we had weekly and sometimes twice a week calls with Bob Fontana, the owner of the company, um, and all the other practice owners to address any issues that we had. We had PPE was never an issue. We never had to start to order it. It's just started coming automatically to the office. We didn't have to order it. We get masks, gloves, gowns, anything. And like Will had said, really having so many offices, Aspen has that purchasing power. I know friends that had really hard time finding PPE. We never had issues with that. Like they went to Shine and they just said like, hey, we'll just buy up whatever you have. And it was like, yeah, you got it. So it's like, they definitely supported big time throughout the pandemic and really took a lot of the stress off of my shoulders. So I didn't have to worry about that type of stuff at that stressful time.
That's good to hear. I actually got furloughed too, so I didn't know what type of experiences the office went through. So that's good to hear on my end.
Yeah, it was weird. Like, and I mean, it was hard not having like the whole infrastructure that we're used to having with you guys at PSC. I mean, we got through it, but I was a lot happier when y'all were back, so we could call somebody if we had a problem with something.
This is another question that just came in, Dr. Brady. With your private practice experience, do you feel like the types of patients is different from patients that come to Aspen, or is it that more location based?
It might be a little bit of both. In my experience, though, it was in the same town. Like I practiced in New Iberia at a private practice office, and then at Aspen. But I was surprised that, like, I guess the patients that we were seeing were different. They were typical private practice patients. They came every 6 months for their hygiene appointments or perio maintenances and stuff like that. I was surprised at how much need there was when I started to work at Aspen. That we would get these patients that had maybe never been to the dentist before or had been 20 years since they'd been and needed all this work done. And it really kind of like it humbles you a little bit when you see like like the need that's there, that all the good that you can do in the world that I wasn't doing because I chose to do private practice for a little while when I could have been helping people the whole time. Because they really do need help, and it's like it's our job to try to get them as much treatment as they can get.
Yeah, that's a good answer. I know when I worked in the operation side of things, one of my doctors always said as our goal is to get the patients back to just coming in every 6 months, like a private practice. So
We've seen, I mean, there's some people that have like, you can change their lives if you just show them compassion and you do the right thing for them. You can turn a patient that is scared of the dentist, that needs oral sedatives and stuff to come in just to sit down, into somebody that comes every 6 months, laughs whenever they're there with your staff and everything. And like, it's just really great to see those types of patients come in and really you see them change.
that's good to hear. Dr. Hooper, this question came in. What hours or what was your schedule, your work schedule like being a new grad coming right out of school? And I guess, do you still have a work-life balance with Aspen?
I do. I mean, in the beginning, the hours are a little bit longer just because I was quite a bit slower than even I am currently. And also we have a couple new assistants that were training at the same time. So not only I was training, one of my classmates was training at the same time, and two assistants. So that made it a little bit longer here and there, to where you're not quite as efficient, with your time. And I mean, let's face it, we're just slow coming out of school. It's just, 2 months ago, I was much slower than I am today, and hopefully I'll be much faster tomorrow. But I was still, like our office really were 8 to 5. Sometimes I finish a little later, like 6 o'clock, things like that. But other offices start a little bit later on the day and finish a little bit later in the evening. And then we work one Saturday, like half a day a month. And I have a 1-year-old, so I do need that balance. And I try to maintain that the best I can.
Dr. Brady, is the schedule any different for you in your practices?
Ours is a little bit different, just because like as an owner, I can kind of change the hours a little bit, like according to how we need it. Our hours, we work 7 to 4, Monday through Thursday. But like Doc said, like that 4 o'clock can easily turn into 5:30, just depending on the day. And then on Fridays we work 8 to 1. We usually try to work like 2 Saturdays a month. We're working 3 this month just because we had to close the day because of the hurricane. So we're just trying to make up that time. But no, I mean, I still have time. I brought my son to karate tonight. Like, I mean, I have time to do stuff after work. It's still a good balance. But we are busy, and but I wouldn't change it. I like being busy. So
Yeah, and I'll just add, most practices will have 3 regular days: 7 to 4, 8 to 5, 9 to 6. One late night, which will be like 9 to 7 on a Thursday, most likely. Half day on Fridays, and then one Saturday a month. Sometimes 2, depending on, December end of year benefits, for insurances, or March when tax season. So that's just kind of the normal schedule. So good question, guys. Um, Question just came in. What does Aspen provide any way to give back to the community? Dr. Brady, if you want to take that.
yeah, every June we do a day of service, and it's a volunteer event, and it's mainly highlighting and trying to see veterans. So we basically we put the word out in the community, to veterans organizations and stuff like that, to try to see as many veterans as we can that day. Just trying to make up the gap, because I didn't know this until I started working, but a lot of veterans who may receive medical care through the VA won't necessarily receive dental care unless they're considered 100% disabled, or they were a POW or something like that. And so a lot of these guys, may be receiving care through the VA, but not dental, and they may be kind of slipping through the cracks. So it's Aspen's way of just kind of getting them in and trying to see them and address any kind of problems that they may have. We usually, part of it is we'll usually adopt one patient. So if somebody has a really good story, that really touches us, then we can adopt them, and we'll do all their treatment at no charge to the patient, just as our way of giving back for their service for us. So that's definitely one thing that we do. There is a mouth mobile, or a healthy mouth movement, where a mobile dental setup will go around and kind of do the same thing with veterans and stuff like that. I participated in that about a year ago, and that was a really great experience also. So there's a lot of different things that they do to reach out to the community, to try to be a part of the community, and help us to give back.
Dr. Hooper, you probably haven't been here long enough to do anything, but do you have anything to add on that?
Yeah, I mean, I haven't been there long enough to do any of the big events, but that's something that definitely, I wanted to be part of with Aspen with. But you do see it, in day-to-day cases. You see a patient that comes in, they have a swollen cheek, and they're like, "Oh, look, I have $50." It's like, okay, like, you are not leaving this office, like that. And we do it all the time. You have patients on radiations, you have patients that they have full mouth cavities all around, and you just take care of them because it's just the right thing to do. They can afford it. They can, they're coming in to get a tooth pulled or things like that, but you kind of treat them comprehensively. And I do see it day in and day out. So if a patient needs it, we've never said no to that.
That's a great point, Doc. You guys will have the ability to make those decisions in your practice. So, it is, these are your patients, and we want you to take care of them. So, um, let's see. This question just came in. Doctor, how many Dr. Brady, how many employees work in your practice? Are you the only doctor? Do you have any associates?
So in New Iberia right now, I'm the only dentist there. We have about 10 or 11 other employees between front office staff. We have two hygienists, and we have like five dental assistants and a lab tech that's in the office every day. So it is also nice working with a lab tech. So you kind of get to know them. You communicate well and are able to execute cases a little bit better. In Lafayette, there's multiple dentists. There's an MCD, as well as two other part-time associates we have there. They also have two hygienists and 4 to 5 DAs and front office staff also.
Dr. Hooper, I know you mentioned you have a mentor, another associate. Any difference in the staffing than Dr. Brady mentioned?
It's really just me as an associate and the mentor, and then one hygienist. We have four dental assistants, the lab tech, and the manager with the assistant manager and the front desk person. So
This is a follow-up question that just came in, Dr. Hooper. Have you seen the benefits of having an on-site lab in the practice?
oh, yeah, absolutely. You can do, I know at school, how long, oh God, how long did it take us to do dentures? A really, really long time. I mean, you couldn't do anything under like 3, 4 months for anybody. It'll take a month to get, anything back from the lab, but we can, do those steps from really one day to the other a lot of times. And just, we do place a lot of immediate dentures, just the reality of the patients that we have. So, having those steps done and done correctly to where you have like a minimum adjustment for those patients just changes your life significantly. Like I'm having a hard time thinking back how long it used to take me to deliver, partial or a denture, but I know that was the reality I was living not that long ago. So having a lab tech guy, I don't remember that. The last time I did a Western was in school probably. So I adjust them here and there, but that's about it.
Dr. Brady, anything to add? Any other benefits to having the on-site lab?
Um, Definitely, like I said before, just being able to communicate with somebody, work with somebody, you get better outcome on cases. And in private practice, we were sending things to Glidewell and some of these other bigger labs, and they do great work. But it's just hard, that communication piece is missing. You can't really sit down and talk to somebody one on one at the bench and look at a setup and then tell them exactly what you want to fix. Um, we are able to do denture repairs same day. That's a big thing for our patients as well as people that come in off the street. We can repair dentures and partials and things. So that's definitely a bonus as well.
Great point. We're getting down to the last few questions of the night. So if anything comes to mind, put them in here. Just to be on the side of transparency, we'll start with Dr. Brady. Is there anything you don't like about working for Aspen or something you want to change? And then we'll go to Dr. Hooper.
I think anybody that works with Aspen will tell you that they have a love-hate relationship with the call center. So we have a call center that basically, when you call any Aspen office, it'll ask you to press 1 if you want to talk, if you're a new patient, or to press 2 if you want to talk to somebody directly in the office that you're calling. So that first time they call the call center and they press 1, it'll send them to either a call center in New York, Chicago, or Phoenix. And they will kind of basically try to find them an office that's going to be able to see them the fastest. And so a lot of times there's issues with the call center. Let's see. The biggest thing is like, quoting prices is usually like a thing. The patient will come in and say that, well, the call center said you were going to take out all 4 of my impacted wisdom teeth for like $3 or something like that. You're like, no, that's absolutely not going to happen. So, I mean, there's some expectation setting that that you just have to make sure that you're maintaining. Like, when the patient comes in and they say, oh, well, I'm here for my cleaning today, or, I'm here to get my tooth pulled. Like, no, you're here for a new patient exam. We're going to see you, assess everything that needs to be done. And then, if we have time, we'll definitely take care of your chief concern, but we just want to make sure that we get an idea about what's going on with your mouth first. Call center, that's the biggest thing I think that everybody will kind of complain about. Let me see. I mean, we are busy, so I mean, like, you do need to want to work if you're going to work for Aspen, because it is there can be long days, can be stressful. There may be some days that you work through lunch or stay after, but it is rewarding ultimately as well.
Dr. Hooper, same question.
Couldn't agree more. I mean, the call center can
Everybody-
get on,
Yeah.
but just because the patient expectation is a little bit different when they come in, or sometimes there's certain insurances that we don't take, and the call center tells them that we take all insurances, and then the patient is disappointed before they even walk through your door. Or our staff bonuses are related to the patient satisfaction and the patient show rate and things like that. They'll put patients on your schedule and then they don't show, or things like that. So that gets a little aggravating, mainly because you care about your staff and you want them to get their bonuses too, and not really. So I can I can second that about the call center. But yeah, the day can get busy, but I wanted that for myself. I wanted to be busy. That if it's a slow day, even for like half an hour to an hour, I go, okay, I do some charting, I do this and I do that. And I was like, okay, what else can I do? Like, I need to get my hands on something or else I get bored. So I wanted that, and it's a learning curve. And I knew coming out of school that was going to be the case. I was aware of all those things as much as I could. Just because I wanted to be busy, I wanted to learn, and I wanted to grow. And there's always growing pains when anything really. And coming out of school to where you have 1 to 2 patients a day, then it's a big learning curve. But I think it's worth it, and if you stick with it, then it makes sense.
Okay, good. So if you guys have any questions or want to set up a shadow or have interest in positions that are open in Louisiana, reach out to me. I'll get you with the right person. I'm sure the doctors wouldn't mind, giving an email address. So if you reach out to them and ask them questions. So last question is an open-ended question. We'll start with Dr. Brady and then we'll go to Dr. Hooper. Anything you want to leave the students with tonight? Anything that you want to let them know right now?
I would say definitely just to keep an open mind about all the different options that you have available for you once you leave dental school. This option wasn't really an option for me whenever I was getting out, but I definitely am glad that I found it. And I just wouldn't let anybody else's opinions about what dental support organizations are really affect your decision. Make sure you kind of go and check it out for yourself. And see what it can offer you, because it's offered me a really rewarding second part of my career, so I'm really happy with it.
Dr. Hooper?
I agree with that. I mean, I definitely, for myself, I know that even at LSU, we kind of try to get people brainwashed a little bit about, not going corporate or things like that. But what I always found it funny is that the people that were trying to tell us, like, you want to open your own office, you want to have, you want to be your own person and all that stuff. But whenever you were asking them about their history, they'll be like, oh yeah, I was, 10 years into the military, I was this and that. And I'm like, so if you didn't do that, would you have opened your practice right away? And usually the answer was no, they wouldn't have been ready or felt ready. But then, they're telling us as a first year, out of school, that we were ready to, to take on that responsibility. And it just never clicked with me, and I was just, all the bad rap that I was hearing, I just wanted to check it out for myself, and nothing that, I could see would really raise any red flags for me. So I just kind of wanted to, keep an open mind and just see what was out there for me. And, it was a great fit and for me and my family. So just keep an open mind and really check it for yourself.
Well, I appreciate you guys, both Dr. Brady and Dr. Hooper, giving me an hour of your time to ask these questions from the students. I appreciate the students joining. Eventually we'll get out of this virtual world and we'll be out having some fun. But for now, thank you for joining, and everybody have a good night.
Thank you for having us.
All right. Thank you.